Welcome, dear viewers, today on our health television. Every year, so many people are plagued by allergies. And the desire for a holistic self-regulation, how we can motivate the body for this through various keys, and especially doctors who think outside the box, who show us new ways to really show us a path to healing in holistic medicine. I am talking about this today with our doctors from Biomed Sonnenberg. And I am very pleased that today we are looking at the topic of allergies holistically. See you soon. Hello, everyone. It's nice that both of you are here. Dear Dr. Thomas Rau, you are the director of the Sonnenberg Clinic and have been with us many times. And I am very pleased that you brought a colleague with you, Dr. Jürgen Strein. I almost said Stein. You've also really been at the Sonnenberg Clinic for over a year, and you are also full of enthusiasm considering the human being as a whole.
Yes, that is so. Thank you very much.
So nice that you are here. We spoke directly in advance. Neural therapy, very, very exciting topic. Above all, also completely underestimated, because I believe this neural therapy has so far only been given a very small space. And you train doctors and therapists anyway in this area, have expanded this topic in such a way that you've added many building blocks. Thomas, may I just start with you? How did neural therapy begin from your perspective? And how did you are already the pioneer of holistic medicine. I must say, you've packed the packages along with it, making the whole thing truly complete.
Neural therapy is a method that is already very established. There are international medical societies for neural therapy. This method is very established. I don't want to go into that now. You can read about it everywhere. We use this method. For me, it was a formative technique or method that has greatly influenced my career in a positive way. And neural therapy is a method, which he can elaborate on later, is a method that stimulates the self-regulation of the human body. That is the big difference from many other methods, especially for allergy sufferers who take something against the allergy. We can, with neural therapy, by injecting certain points with specific remedies, all biological, stimulate the body to process it itself.
So you essentially combine neural therapy, in this case probably procaine, with homeopathic remedies that may also be used for allergies.
The strict neural therapy uses only either lidocaine, more the Austrian school, or procaine. But they are similar substances and injected into certain points or segments. There is a whole doctrine on this, and there are quite a few doctors practicing neural therapy.
Excuse the very brief interruption, dear viewers, but you will now see a small excerpt from a very special program. And if you find it exciting, then click on the corresponding link at the bottom on YouTube and watch the whole program. Have fun, and goodbye, everyone.
It also deeply frightens me because these women are actually not properly and well informed. It has been proven that, in fact, these silicone breast implants are not sealed from the very first moment. Education is actually the be-all and end-all.
We have integrated, this is a development of over 20 years. We have included it, which is why we no longer officially call it neural therapy, because that is a method described by Hunecke. We have expanded it, and we use certain acupuncture points where we inject these substances. Additionally, I have developed a technique that allows us to give homeopathic or isopathic remedies, so everything natural, which we can provide additionally for this or that ailment. We also call it regulation therapy, neurovegetative injection therapy, we call it. I know it's much too complicated. We do call it neural therapy, but we integrate the acupuncture points and the remedies. So we have three methods in one. The acupuncture, the injection of these self-regulating drugs, namely remedies, procaine, and the homeopathic remedies or isopathic ones that we add to it. So we have this triple therapy, and it sometimes works profoundly for intestinal complaints, for quite a lot of chronic suffering. With hay fever, one can say afterward, it's just incredible how it works.
Dear Jürgen, maybe just briefly, so that we can get to know you because you are with us today for the first time. A few brief words about you, your path. How did your journey lead you to Switzerland?
I am a specialist in general medicine, trained in Germany. Already in further training, in practice training, I began biological medicine in 2012. And that fascinated me. I found it so exciting, and it intrigued me to continue it after my further education, also in my own practice in Germany.
So you had a practice in Germany?
Yes.
Okay.
And my family and I, we moved to Switzerland 2 years ago.
Nice. You are now in Sonnenberg at the Sonnenberg Biomed Center, and you really have your own area there. And I can hear a bit that this neural therapy, this holistic approach, has become your pet project and passion.
Absolutely. As Thomas Rau said, it influenced him a lot. So I can also confidently say that it's the best procedure I've ever learned. It's very versatile, and you can really achieve a lot with it. And the effort is ultimately minimal. And if you can achieve very good results with minimal effort, then that speaks very much for the procedure.
How can I imagine that if I am a viewer now, whether I am from Germany or from Switzerland or abroad? We really have international viewers from all over the world now. It's really nice. So how can they get in touch with you or the therapy? What can they expect? Do I have to come 20 times, put in a huge effort, or is it done in 5 minutes?
Well, I have to say the effort is not very high, especially in the field of allergies. The results are quite good. On average, I can say about 2 to 3 treatments until the first cessation of symptoms. So it is actually reproducible. We even have our own employees who come to us to get treated, now for hay fever. And that's exactly how it was. A staff member was with me recently and developed symptoms again after 6 weeks. We then repeated the treatment.
It was one treatment, then it was gone, so to speak.
Yes, and then it's gone again for a few weeks. It is very individual, so you can't really say you need 2 or 3 treatments now. It can actually be that in the ideal case, the symptoms can disappear after 1 treatment. We've had that before. There was a young man from Australia, a student from Australia, who really, well, that amazed me too. After 1 treatment, he was symptom-free. So I was already mentally preparing for the second treatment, how it should be followed up. And yes, but that's just, you never know. Ultimately, the patient's body gives the answer on how many treatments are necessary. And it can also be the case that other issues arise, so-called interference fields. If the symptoms return after a short time, you have to take a closer look to see if there are any interference fields.
Could that be an interference field? Or could it be if I, of course, regulate my self-regulation through the cocaine crank-up, and I now, let's say figuratively speaking, am really able to dissolve the first layer of the onion because I have strength again in my body, so that the next layer of the issue simply reveals itself?
I wouldn't see it that way. Ultimately, if you treat, for example, a central ganglion, thereby eliminating the symptoms, and it still returns, there are interference fields present. In 70%, the interference fields are in the jaw-mouth area.
Ah, you mean Rantis? And okay, all right.
About 10% are surgical scars. So they definitely need to be treated, in any case. But you quickly notice that if the therapy doesn't take effect, or the symptoms return very quickly, then it's worth checking again for interference fields.
Yes, as I said before, and he does that too, we integrate certain acupuncture points. And there are regulatory points, so-called association points or cardinal points in acupuncture, which regulate, and especially in cases that are not done with one hay fever shot. And I always tell people, you can come again if you want. That is included. So because most of the time it gets better. So no risk for me. But for those who come back, we have to get to the base. Why is the regulation disturbed? That means why is the body acting up with its immune system and overreacting? I don't want to psychologize, in no way. No, then you have to inject the intestinal points, that is the microbiota points. And that's down here at the abdomen, 2 special acupuncture points. And when I inject those together, then it gets better in very, very many cases. Then we know, however, that the disturbance is the endobiome, the microbiome, the gut flora world, the small intestine world, which is still the largest organ, is disturbed and then causes a misregulation in the immune system. Then we actually have to treat the small intestine as well. This is biological medicine.
Super exciting. What are your experiences in sustainability now, regardless of allergy or not, but really in the regulation of the gut microbiome? We have also said that many people become more stable, more motivated, and perhaps also have less depression, anxiety, and the like. Can it be maintained? Because we hear so much about gut flora. You need gut bacteria, and the foundation must be right, and then a little drop here, a little fungus there. Is this really how the intestine can be regulated? Or can I really influence it through such a neurotherapy so that it sustainably really optimizes the gut flora?
Ideally, the patients would then adopt a plant-based diet. And under this, the good results of the therapy can be maintained quite well.
Okay, so I just create the environment for good bacteria.
Yes, then of course you can assist with probiotics, with other substances. Focus on developing a good microbiome. But ultimately, switching to a plant-based diet is highly recommended in this case.
I am often asked, what exactly is the Biomed Center? Is it a clinic? Can you stay overnight or not? So maybe you can say a few words about that.
Yes, you can think of it as a day clinic with an integrated hotel operation.
So I'm not in a clinic. I'm in a hotel, and I also get my meals there.
Exactly. Yes, well, there are actually 2 things. We offer a medical practice with several doctors and numerous therapies, like a large, huge practice, a group practice, People can come from abroad, from Switzerland, or from the village, and simply apply and learn about our holistic medicine and what they can do themselves. Outpatient. The second thing is that we have a hotel with beautiful rooms. A little proud. We are the first 4-star vegan hotel in Switzerland. So we have received this recognition. It's really a very beautiful hotel, wonderfully located. And because of this offer, we have clientele from all over the world, really from all over the world. And then they stay. Now comes the interesting intermediate group. We have people who come to us outpatient for asthma, for, arthritis, pain, all chronic ailments. And they realize, oops, next time I'll stay 2-3 days. And so we really have an increasing number of patients who come to us for 2-3 days. We treat them intensively and then perhaps again in 6 weeks or 2 months. So this combination this is the big unique feature we have, that we treat totally individually.
So I could theoretically, if I see a show with us, or we also had such a great show with high blood pressure, so many people came to you where you really say, hey, I want to do, for example, hyperthermia, and can then really make an appointment with you, or say, I would like to have a checkup from you with me, or from you with a reasonable blood test, and not the classic. I had my comprehensive blood test checked. Everything's great, and I always think, sure. There's nothing in it.
I would like to have hyperthermia, or I would like to have an ozone treatment, or a colonic. I just saw it in your face already.
There came such. I recognized it.
Please come. We can offer you that. But you need a medical consultation, not just for legal reasons, but simply because I then realize, whoa, this patient. First, he has something noteworthy. Otherwise, he wouldn't want hyperthermia. Second, why does he want to do it with us? Something hasn't gone ideally so far. And if you engage with that, you quickly see that the regulation of humans or the enterbiogen or whatever doesn't add up. Very often they are also cancer patients who really want a more comprehensive therapy. That's our great strength. Just do something just because. Unfortunately, that doesn't work. It works, but it doesn't bring much.
You really do get patients where you say the damage is already done to some extent. So these are really the patients who say, I've already been to so many doctors or even colleagues who say, okay, I am holistic, but now I've reached my limits. And they come to you. So it's a completely different caliber in therapy, especially on the topic of allergies. Now, we've only talked about hay fever, but there are so many allergies. Perhaps you can also open up the field again and say that this doesn't just refer to hay fever, neural therapy, but we can really...
Yes, so there are indeed many connection possibilities. And in the simplest case, it's of course just the runny nose. So there are 6 points in the face that are injected. And if the lungs are involved, we would include the acupuncture points of the lungs. And we have seen good results there as well.
And what about house dust, mites, cat hair, allergy, pet allergy? Yes, of course, also psoriasis, neurodermatitis. These are all borderline topics.
Yes, and with neural therapy, we actually influence the autonomic nervous system. So we induce a reduction of the sympathetic nervous system. It's usually hypertrophied in most patients anyway. And this also has a positive effect on other areas. And when there are more stubborn cases, of course, you can then take deeper ganglia. So there is something like that. You go from the surface, then in neural therapy, to the depth, to then treat central ganglia. And just below that, so then you already get. You can also do that with the VNS. We also do the VNS analysis. When patients come to us, we see how pronounced the sympathetic nervous system is. HRV.
Yes, it is the same. VNS means vegetative nervous system analysis. Yes, and I'm amazed. For example, I have many asthmatics and severe ones at that. And they have all already been in pulmonary clinics or with specialist doctors. So really all of them. And then they come to us. We do neural therapy, day one. And then also repeatedly measure the vegetative nervous system and see that they have a profound disturbance of this self-regulation. That's why they have these spasmodic constrictions that they have. That depends on the vegetative nervous system. Now he has, that is both of us, of course, and all the doctors in our clinic. We know neural therapy, and we know where is the control center for the diaphragm and the lungs, or for hay fever, for instance. And so we can change this switching point.
And it should perhaps be emphasized again, not that a viewer might now think, I'll just find a doctor on Google who practices neural therapy, but really reiterate clearly that you combine active ingredients that are truly specifically tailored to this issue, which is also health-related.
I train doctors, alternative practitioners from the German-speaking but also from English-speaking areas. I train. We have seminars with us, or I have them elsewhere. And there are many colleagues who are already doing neural therapy, and they say it is worlds apart when we include diacupuncture points and these isopathic medications from the company Sanum or Heal. It simply works much stronger. Our system is a different or an additional one.
Yes, and then one really has to say, which I find nice, Alexandra with you. Dr. Kothaus, it really does bring this level again. What's behind the illness? And now, of course, I have the key. On the one hand, I have acupuncture, homeopathy, then the plant's active ingredients that I have processed in it. They also have an influence on the whole regulatory system if you look at them holistically. Also, where lung is also about taking living space, fear or fear of death, whatever. What kind of gasp was that?
Instead of a cough, I have the gasp.
I know I always bring in the psyche. But that's why Alexandra is still someone who gives your patients the opportunity to look on all levels.
Yes, absolutely. Alexandra is an enthusiastic hypnotherapist. And we also do it this way in the practice. If we see that they would benefit very well from hypnosis, we refer them to Alexandra.
Nice. Is there anything else important?
There are many, many people who come because of a local problem. Can you improve knee pain for me? Can you do something else instead of operating? Well, I'm not going into that now. You can do a lot with our neural therapy, but the knee is not healed. And it really needs something long-term. Exactly the same with asthma, exactly the same with irritable bowel syndrome, exactly the same with rheumatism. There is always a regulatory disorder behind it. The autonomic regulation is also related to the psychological situation. I say yes, you just have to build up the intestine properly. Then you will also feel better psychologically. Our fellow doctor, Dr. Kothaus, an absolutely excellent doctor, comes more from the emotional field and can do it from that side. Both sides are the strongest. Yes, and that is the long-term therapy that we can apply in an extremely individualized way.
And we have very positive patient feedback from it. So patient satisfaction is thus very high. Because then we also cover the mental spiritual side.
Nice, great. So thank you very much for being here. And we will do a few more interviews in this constellation on various topics, especially the topic of diabetes and neural therapy. Interests me a lot, how we can integrate that there as well. You also have great success with both type 1 and type 2?
Yes, I can certainly talk about that.
Gladly, super. So thank you very much. Did you want to say something else?
No, I'm good.
It was just like, I thought nice. Thank you for being here. And until the next time, dear viewers, yes, wonderful to always get to know new tools on how we can learn quite a bit in self-regulation and also in our knowledge for our body and our health. I hope you could also take a lot away for yourself. And of course, I am happy if you watch.
Thank you very much for that. See you soon. Bye. Thank you for watching Swiss Health TV QS24. Please don't forget to subscribe to the channel down here, or watch all our programs ad-free on Wikisana, or enjoy this selection of programs. I wish you all the best. Until another time, and goodbye everyone.